Committee on Health and Demography is hereby called to order. For the record, I'd like to acknowledge the presence of our distinguished counterparts from the House of Representatives. Good day and thank you very much for participating in this hearing. Today, we will discuss several local bills which seek to upgrade the existing public hospitals or establish new hospitals in the country. For our records, may we request the committee secretary to officially acknowledge the resource persons present today. Kindly, Ms. Committee Secretary.
Yes, good morning to our chair and to all our guests. We would like to acknowledge all the resource persons who have logged on. From the Department of Health, Yusek Lilibeth David, Dr. Maria Teresa Vera, and Dr. Melissa Sena. From the DBM, Sec Cristina Clasara and Director Jane Abelia. For House Bill 10451, Dr. Ricardo Ruñez Jr., Chief of Hospital of Baguio General Hospital and Medical Center. For House Bill 10324, Dr. Melisio D., Medical Center Chief, Ospital ng Palawan. For House Bill 10242, we have Representative Edgar Chato and Dr. Mutia Kismet Macuno, Medical Director, Governor Celestino Gallares Memorial Hospital. For House Bill number 10013, we have Representative Jericho Nograles and Dr. Brian Dalid, DRMC Medical Center Chief. For House Bill 10180, Representative Antonio Tony Pet Albano and Dr. Arlene Lazaro, Provincial Health Officer. For House Bill 10179, Representative Noel Villanueva. For House Bill number 10463, Representative Francisco Kiko Benitez. For House Bill number 9917, Dr. Michael Resurrection, Clinic Director, City of Meycauayan Dialysis and Diagnostic Centers, and Dr. Christian Roque, City Health Officer. For House Bill number 9779, Representative Alfonso V. Omali Jr. For House Bill number 10464, Representative Jam Baronda. For House Bill number 10376, Dr. Rosalie Manubay, Chief of Hospital of Antonino Roman Memorial Hospital. For House Bill number 10362, Attorney Annalisa Gonzalez, Chief of Staff, Office of Representative Hofer. For House Bill number 10254, Representative Vincent Franco Duke Frasco. For House Bill 10248, Dr. Raquelina Benito, Chief of Hospital, Unayan Municipal Hospital. For House Bill number 10247, Dr. Mashiding Lomandong, Chief of Hospital, Balindong District Hospital. For House Bill number 9980, Representative Florida Robes and Dr. Rosel Tolentino, City Health Office. For House Bill number 10583, Representative Rogelio Neil Roque. For House Bill number 10297, Representative Carlito Marquez. For House Bill 9537, Representative Abraham Bambol Tolentino. For House Bill number 10452, Representative Alan Ecleo. For House Bill 10055, Representative Joseph Santonino Bernos. For House Bill 9878, Representative Doy C. Liachon. And for House Bill 9837, Representative Johnny T. Pimentel. That's all, Mr. Chair. Thank you.
Thank you, Committee Secretary. Let me now give my brief opening remarks. As I have said many times before, establishing and upgrading public hospitals should not be treated as a burden, but an investment. Sa pandemyang ito, nakita natin kung gaano kahalaga ang investment sa kalusugan, nahirapan tayo noong umpisa ng pandemya dahil hindi natin binigyang pansin itong nagdaang mga dekada, pagpapalakas ng ating healthcare system capacity. Bagamat patuloy na bumababa ang mga bagong kaso ng COVID-19, kailangan pa rin nating maging handa. Dahil natin alam kung ilang pandemic ng COVID-19 ang darating. Huwag po nating hintayin na tuluyan bumigay ang healthcare system natin at malagay sa anib ang buhay ng ating mga kababayan. Kasi po ako sa ng ating mga kababayan sa pag-iikot ng mga ospital sa buong bansa, nakakapanlumo pong makita na yung mga ibang pasyente nasa corridor po ng ospital available na some hospitals have already exceeded their bed occupancy. Pati rin ang kalusugan at seguridad ng ating mga health workers. Bigyan po na upgrading and establishing DOH Hospital are pending signature of the President. With that being said, funding for the upgrade and establishment of these hospitals for discussion should also be ensured so that this won't be unfunded loss. In this regard, the national government and the local government units must work together to provide funding for much needed health services. Magtulungan po tayo para makapagbigay ng maayos na serbisyo sa ating mga kababayan. Asahan niyo po na patuloy na magtatrabaho ang kumiting ito hanggang sa nalalabing araw ng kongreso ito para ipaglaban ang pagpapalakas sa ating mga pampublikong ospital. Wala pa pong ibang senador na nasa linya. For an orderly discussion, we will discuss these hospitals by cluster. We will first discuss DOH hospitals, followed by LGU hospitals with initial budget in 2022, then LGU hospitals without budget in 2022, and lastly, hospitals for renationalization. Considering these are many bills up for discussion, kindly limit the manifestations to a minute or two if possible. Thank you very much. Let me start with the DOH hospitals. First is House Bill number 10451 and Senate Bill 2151, increasing the bed capacity of the Baguio General Hospital. May we recognize Congressman Mark Go for his manifestation? Parang nakikita ko siya kanina.
Thank you very much, Mr. Chair. Magandang umaga po sa inyo, Chairman Bongo, the members of the committee, yes, thank you very much, Mr. Chair. To the members of the committee and the invited resource persons, thank you very much for including in today's calendar the proposal to increase the bed capacity of Baguio General Hospital and Medical Center from 800 to 1,500 beds. For the information of everyone in today's hearing, during the 17th Congress, the bed capacity of BGH was increased from 500 to 800 beds through Republic Act 11084, and I thank this committee and all the senators who help us enact the measure. However, to put things in perspective, at the time that the said law was enacted, Baguio General Hospital was already operating at an occupancy rate of 144.17%. As such, the increase by 300 beds merely accommodated what was already the existing situation at the time. This bill we are now proposing, on the other hand, is not just the reactionary, but geared towards capacity building and countryside development. Even with the approval of our 800-bed capacity in 2018, the hospital continued to operate beyond the approved occupancy rate. In 2018, Baguio General Hospital had an occupancy rate of 117.77%. The figure even went significantly higher in 2019 at 127.73%, taking a toll not only on our facilities but also on our overworked medical and administrative personnel complement. During 2020 and 2021, at the height of the pandemic, hospitals were instructed to operate only at 50% bed capacity in compliance with the DOH directive. However, due to the referral of patients coming from surrounding provinces and municipalities needing specialty services, which only BGH could provide at minimal financial burden, our frontliners had to continue serving the people beyond the rate or beyond the set occupancy rate. And the hospital continued to operate at 57.4% bed occupancy. With the number of COVID cases consistently going down and hospitals are now permitted to increase admissions, it is projected that for the full year of 2022, Baguio General Hospital will be operating at 120.75% occupancy rate on a par with our pre-pandemic experience. For everyone's information, Baguio General Hospital is currently on track to implement in full 15 different specialty programs within the next 4 years. This year, the hospital will be implementing in full its cardiovascular care program. Other specialty programs lined up for full implementation include renal care and transplant, lung care, brain and spine care, orthopedic center, cancer care, infectious disease and tropical medicine, and mental health, among others. It is also a residency training center currently in 16 different specializations. As it is, BGH caters not only to residents of Baguio and CAR, but also for patients coming from Regions 1 and 2. Moreover, at present, about 80% of hospitals' clientele are indigent patients. Many of our kababayans from the north simply do not have the means to send their patients to the big hospitals in Manila to receive quality and comprehensive medical and healthcare services. We in the north also deserve access to a wide array of highly specialized medical services. BGH is already in the process of establishing these programs and positions itself as the premier referral center in Northern Luzon, offering leading-edge specialty services. Hopefully, through your help, Mr. Chair, Filipinos from our side of Luzon would no longer need to travel all the way to Manila for these services, sparing them from additional cost and inconvenience. We appeal to the members of this committee to help us invest in Baguio General Hospital for continuous innovative services, expansive training programs, and more research outputs for better health outcomes for our people. Hence, the approval of this measure, increasing the bed capacity of BGH from 800 to 1,000 beds, is earnestly sought. Again, thank you very much, Mr. Chair, and good morning.
Next, we have House Bill number 10324, increasing the bed capacity of the Hospital ng Palawan. If Congressman is not present, may we hear Dr. Melesio D., Medical Center Chief.
Thank you, Mr. Chair. Regarding po sa House Bill number 10324, regarding increasing bed capacity of Hospital ng Palawan. Hospital ng Palawan is one of the DOH hospital in Mimaropa, and it's as an island region po situated in Palawan. We cater primarily sa province of Palawan po, no? And currently level 2 ang license, and we have been catering to patients of around an average of 300 prior to the pandemic, no? And it's been increasing since 2016. And as we expand our services, Your Honor, dumadami din po ang referrals coming from the 17 LGU hospitals within the provinces. And as such, for us to be able to carry out our mandate based on the Philippine Health Facility Development Plan, which was approved by President Rodrigo Duterte way back in 2017, the OMP is expected to provide a general tertiary care with some specialty to align with the Universal Health Care Act. With that, all resources needed for us to be able to carry out our services for our mandate for the province of Palawan and for the region itself. So we earnestly sought for to increase in bed capacity po to 400 bed so that we'll be able to respond with a quality health services to our clientele po. Thank you, Mr. Chairman.
Next, we have House Bill 10242 and Senate Bill 2244, upgrading the Governor Celestino Gallares Memorial Hospital. We recognize Congressman Edgar Chato, sir.
Thank you very much, Mr. Chair, Senator Bongo, and members of the committee and invited resource persons. The health and medical services of Gallares Hospital in Bohol has accordingly and immensely evolved over the years. From a provider of basic health care, the hospital is now a level 3 hospital with specialty centers and training facilities. The ongoing modernization project will support the National Health Policy on Universal Health Program as embodied in the Department of Health Reform Agenda and the attainment of the health-related Millennium Development Goals. The project will likewise support the Central Visayas Regional Strategic Framework of providing adequate health facilities and resources in areas that were underserved, unserved, and those affected by calamities, as contained in the Central Visayas updated Regional Development Plan. And to implement, Mr. Chair, the modernization program, which was approved by the NEDA board in 2016, and the recent approval of the increased bed capacity, it is proposed that the Governor Celestino Gallares Memorial Hospital be converted to Governor Celestino Gallares Multi-Specialty Medical Complex, which shall be comprised of the Ambulatory Care Center in Tagbilaran City and the Multi-Specialty Medical Center in the municipality of Cortes. The Multi-Specialty Center in Cortes is envisioned to house a medical complex that will include modern facilities for critical care, diagnostics, dialysis operating units, and patient care, among others. It is also envisioned to have an improved center for infectious diseases and tropical medicine, as well as the first center in the province dedicated to mental health and behavioral sciences. Ultimately, the proposed bill aims to greatly improve the medical facilities and services, as well as ensure accessibility and affordability of healthcare services in the province. It will also decongest hospitals in nearby provinces, especially in Cebu and the nearby island provinces. And finally, it will open opportunities to Boholano professionals in the medical field, including those in medical tourism. It is in this regard, Mr. Chair, that we hope this measure can be approved, and this is sought earnestly for the approval, Mr. Chair. Thank you, and good morning.
Salamat, Congressman Chato. Senator Angara wants me to make of a record that he supports this measure. He filed Senate Bill 2244. Ako po mismo yata punta dyan sa inyong hospital.
Mr. Chairman, Mr. Chairman.
Go ahead.
Mr. Chairman. Mr.
Hi.
Chairman, I'm also
Senator
supportive of the
Tolentino.
bill filed by Congress. Yes, Mr. Chairman, I'm also supportive of the bill filed by Congressman Chato for Bohol.
Thank you,
Thank you
Senator.
very much.
Thank
Chairman.
you.
Thank you very much, Mr. Chair. Thank you very much. Senator Angara and Senator Tolentino.
Salamat po, Senator Tolentino. Congressman Chato, meron tayong malasakit center dyan sa Governor Celestino Gallares Memorial Hospital. Naalala ko po, sir. I hope it's doing fine, no? Nakakatulong naman po dyan sa inyo sa Bohol.
Yes po, pati yung dalawa sa Bohol, yung sa Gallares, which is the biggest government hospital, and then another one in Ubay, which is Del Valle Hospital. So I thank also Senator Angara for sponsoring in the Senate Bill 2244. Kapartner talaga natin siya sa healthcare din, kasama si Senator Tolentino. At kayo po, Senator Bong, maraming salamat.
Salamat, Congressman Edgar Chato. Next, House Bill number 10013, upgrading the Davao Regional Medical Center. Ito po'y sa Tagum, Davao del Norte. Parati rin po akong napapasyal dyan mismo. Nakikita ko gumaganda na yung hospital. Strategic po siya dahil it caters from patients from Davao del Norte, Davao de Oro, and Davao Oriental. Meron rin po malasakit center dito sa Davao Regional Medical Center. If Congressman Jericho Nograles is not around, may we recognize Dr. Brian Dalid, the medical director. Andiyan na?
Maing buntag.
Yes, sir. Congressman, andyan ka na pala. We recognize Congressman Jericho Nograles if you have any manifestation, sir.
Thank you, Mr. Chair, my favorite Senator Bongo. And good morning to all our members of Congress today, our senators and representatives from the House, as well as our medical directors. I have the distinct honor to support the expansion of the bed capacity of the Davao Regional Medical Center in Tagum City, which is the foremost cancer center for the whole island of Mindanao, as well as the only accredited kidney transplant center for the whole of Mindanao. Mr. Chair, I hope that the Committee on Health and Demography will support this measure. The Davao Regional Medical Center is undermanned, as it would be explained by Dr. Brian Dalid, but they are very capable and hardworking men and women of the medical field. So the approval of this measure is earnestly sought. Thank you, Mr. Chair.
Salamat, Congressman Jericho Nograles, sir. Next is House Bill number 10519, establishing the Eastern Cordillera Regional Hospital. If there are no resource persons for House Bill 10519, we will just ask them to submit their position papers. Let me, since these hospitals are DOH hospitals, the national government will shoulder the funding for their operations. May we now hear the comments of the DOH and DBM on the bills on DOH hospitals. Napaka-importante po ng inyong position dito at komento dito, lalo-lalo na po sa magiging committee report natin. May we hear Yusek Lilibet David of DOH and Asek Cristina Clasara of DBM.
Thank you, Senator Go, your honors. May I just manifest the DOH position for the various bills on upgrading DOH hospitals. The Department of Health supports the proposed House bills seeking to upgrade the capacity of DOH hospitals. These measures complement the implementation of universal health care by increasing the country's capacity to deliver health services. The department will be submitting further details of its proposals through a position paper. Thank you very much, Senator.
From the DBM, Ma'am Cristina Clasara.
Thank you. Thank you, Your Honor. Good morning. And for the DBM, we acknowledge, sir, the need for the increase of the bed capacities of the mentioned hospitals, and we interpose no objection as to the increase of the bed capacity. But again, as this would require, but increase in budgetary requirements of this hospital, we suggest that these hospitals contend with the standard budgetary requirements for hospital development as provided by the DOH. And particularly also for capital outlay or infrastructure, the same may be included in the health facilities enhancement program of the DOH, again consistent with their health facility development plan. So it means lang that we interpose no objection, but it will go the usual budgetary process of review and evaluation by the DBM, and again the power of the purse lies naman po with Congress after we submit the President's budget.
Thank you. Thank you very much.
Salamat, ASEC Cristina Lazaro of DBM. Are there any other comments from my fellow senator? If there are none, the bills upgrading the establishing DOH hospitals are hereby approved. And then let us now discuss the LGU hospitals with the initial budget in 2022. Please indicate if an LGU resolution was already issued in support of the bills. First is House Bill number 10180, Act increasing the bed capacity of the Governor Faustino ND Senior Memorial Hospital. We give the floor to Congressman Tony Pet Albano, sir.
Sir, magandang umaga sa iyo. Unang-una, nagpapasalamat kami at binigyan niyo kami ng panahon dito po sa ating mga necessary hospitals, especially the increase in the capacity from 100 to 500 bed capacity of our hospital in Ilagan, Isabela, the Governor Faustino and the Senior Memorial Hospital in the city of Ilagan. Ito pong House Bill 10180, let what I have here become my introductory speech to this meeting. At alam ko pa naman po, nasabi niyo na po ang mga cases kung bakit po kailangan natin mag-increase ng mga hospital beds para sa ating pong mga kababayan, lalo na po sa probinsya ng Isabela, kung saan siya po ang largest province dito po sa Region 2. At nangangailangan talaga kami ng extra bed capacities. And I will not belabor this meeting because I know there are a lot of House bills and Senate bills to be tackled. And alam ko naman po, kayo mga senador na aming mga kuya ay nandyan parate, lalo na po kayo, Senator Bongo, na nag-establish ng Malasakit Center dito sa Ilagan City. At we have our doctors here from that hospital to attest that they are working hard and very thankful for the Malasakit Center po na itinatag nyo, Senator Bongo. Yun lang po at maraming salamat po at we're looking forward to having this bill passed so that we can construct soon.
Salamat, Sir Tony Pet. Next is House Bill number 10179, increasing the bed capacity of the Concepcion District Hospital in Tarlac. We recognize Congressman Noel Villanueva, sir.
Good morning po, Mr. Chairman, Senator Bongo. Maraming salamat po sa pagkakasama ng House Bill number 10179 in today's Senate Committee hearing of the Committee on Health. Naniniwala po tayo na kailangan pangalagaan ang kalusugan ng ating mga kababayan dahil ito po mismo ay nakapaloob sa Section 15, Article 2 ng ating saligang batas, that the state shall protect and promote the right to health of the people and instill health consciousness among them. At kami po ay umahanga sa advokasya ng ating pinakamamahal na Senator Bongo na hangad niya ang magkaroon ng serbisyong medikal sa lahat ng mga mamamayan, patunay lamang sa kanyang mga ginagawang mga programa at proyekto katulad ng Malasakit Center. Kaya po ako'y naniniwala sa kamay po ng Senate Committee on Health, aming isinusumamo ng House Bill number 10179 ay mabigyan po ng agarang approval para nang sa gayon ang aming mga kababayan po dito sa 3rd District ng Tarlac ay magkaroon ng isang pampublikong ospital na kanilang maasahan sa oras na kanilang pangangailangan. Maraming salamat po.
Salamat po, Sir Noel Villanueva. Meron rin tayong... Oh, wala na. Sorry. Next is House Bill number 10463, increasing the bed capacity of the Teresita, Lopez, Jalandoni Provincial Hospital. We recognize Congressman Kiko Benitez for his manifestation. Sir, magandang umaga po.
Magandang umaga po. Salamat, Senator Go, for including the bill in today's hearing. No? Good morning to all the representatives and the senators and the resource persons here. I'll keep it short, Senator Go, kasi madami nga naman pala kaming nakapila sa araw na to. Sa probinsya ho namin, sa Negros Occidental, ang aming pong apex hospital ay ang Teresita Jalandoni Provincial Hospital na 100 bed capacity po siya. No? At sa ngayon, malinaw po ng aming authorized bed capacity na 100 beds ay kulang kasi nasa 300% na po ang aming occupancy rate. No? So, sana naman po matulungan kami at mabigyan ng approval no ang aming measure na kailangan po namin sa Teresita Lopez Jalandoni Provincial Hospital ng augmentation ng kanyang facilities and personnel no to meet the higher demand, and this is in conjunction, sir, with the province to provide for the personnel and increase in its MOE. Pero sana naman po makatulong tayo sa capital outlay naman from the DOH for the increase in the bed capacity from 100 to 300 beds. Yun na lang po muna at maraming pong salamat sa inyong lahat.
Salamat, Sir Congressman Kiko Benitez. Next is House Bill number 9917 and Senate Bill 178 for establishing the Ospital ng Meycauayan. May we hear from Congressman Henry Villarica, sir? Yes, sir.
My name is Minjo Luspo, Mr. Chair.
Yes, sir.
I am the Chief of Staff of Congressman Henry Villarica of the 4th District of Bulacan. I'm tasked to make this presentation for and on behalf of the Congressman who, with our apologies, cannot make it to this meeting, sir. First of all, well, thank you for this opportunity to present House Bill number 9917, entitled an act establishing in the city of Meycauayan, province of Bulacan, a tertiary hospital to be known as the Hospital ng Meycauayan and appropriating funds therefore. This bill was filed because in the 4th Congressional District of Bulacan, there is only one hospital. the Rogasiano M. Mercado Memorial Hospital, which presently serves its growing population in the 4 areas of the district, namely municipalities of Marilao, Ubando, Santa Maria, and Meycauayan City. For the record, Your Honor, we submitted City Resolution number 2021-094 entitled, just read into the records the title of this resolution, a resolution supporting the establishment of the Ospital ng Meycauayan with commitment to provide funds for its operation, management, and maintenance. This resolution seeks to support House Bill number 9917. It cites the rising health concerns and medical needs of its growing population. If at your pleasure, Mr. Chair, we have with us some invited guests from the city of Meycauayan who are prepared to answer the specifics on this hospital if there are any questions. Thank you very much, Mr. Chair, and we look forward to the approval of this bill in your committee. Thank you very much.
Salamat, Sir Luz po. Next is House Bill number 9779, upgrading the Oriental Mindoro Central District Hospital. May we hear from Congressman Alfonso Umali, sir? Congressman Umali, sir?
Sir, just a minute, sir.
Okay lang po.
Boss, good morning.
Yes, sir. Go ahead po.
Sir.
Sir.
Boss, yung sa akin, yung regional hospital, yung sa Oriental Mindoro Regional Hospital, and Oriental Mindoro Provincial Hospital, yun yung final kong bill. So, hopefully, maano na to, talagang matapos na namin. Kasi talagang kulang na kulang yung aming, yung mga hospital beds, kulang na kulang yung aming facilities. Kaya, noong tinamaan ng COVID, talaga namang medyo hirap na hirap kami noon. So, baka pwede namang pakiusap na talagang once and for all, mapasa natin ito. And we've been looking forward to this ever since when I was still governor. So ngayon, nandito tayo ngayon at sa Congress nga, baka naman mapakiusap na, boss, na talagang mapasa natin ito.
Salamat, sir, no? Ito po yung House Bill na na-file po ninyo, House Bill number 9779, upgrading the Oriental Mindoro Central District Hospital. Ito po yung nasa record, sir, Sir Umali.
Yes, yes. At saka yung isa, yung regional hospital, yung Oriental Mindoro Provincial Hospital into a regional hospital.
Wala.
It has passed the Congress also. And hopefully, pagdating dito sa committee sa inyo, dalawa kami author. Dalawa kami author ni Kong Doyle Liatson.
Yes, sir. Salamat po. We will tackle it later. Ito po yung RENAT po. Next, we have House Bill number 10464 and Senate Bill 2457, establishing the Iloilo City Hospital. We call on Congresswoman Jam Baronda.
Yes, thank you so much, my favorite senator. Before I proceed, I would just like to say thank you for making sure the speedy approval of Republic Act 11496 or the expansion of the hospital bed capacity of Western Visayas Medical Center. And not only that, making sure na ma-release na yung notice of cash allocation. Ngayon po, nag-hire na tayo ng initial na 700 medical personnel. And this is in line also with your thrust in making Iloilo City or Western Visayas Medical Center as one of the heart and lung center of Western Visayas in the near future. Thank you so much, Senator, also for always being there for us whenever we needed you. Esteemed colleague, I would like also to acknowledge, of course, my very dynamic, hardworking mayor for his support. He is present now in the Zoom meeting, along with our city health officer and her team from the Iloilo City Health Office, Dr. Annabel Tang, and of course, Mayor Jerry Treñas. Mr. Chair, esteemed colleagues, good morning po, and of course to Senator Mig Subiri for as our counterpart in this measure and making sure not to have to allocate extra fund for the establishment of Iloilo City Hospital. As of present, we have 9 licensed hospitals in Iloilo City, Mr. Chair. 7 of the 9 are privately owned. 1 is managed by Department of Health, and 1 is under Western Visayas State University. And none of 9 officials and none of 9 hospitals are managed and controlled by Iloilo City government. During the time of pandemic, we find this reality problematic. Based on our data and considering Iloilo City's 2020 projected population of 471,043, the numbers point at an estimate bed to population ratio of 1 to 250. 1 bed for every 250 Ilonggos. Suffice to say, we need to improve this. Mr. Chair, this legislation aims to increase Iloilo City's capacity in addressing the medical concerns of Ilonggo. In view of the growing population and by virtue of city being the regional center of Western Visayas, it is vital that we have the necessary personnel, equipment, and space to attend to those who require proper healthcare services. The positive economic spillover effect of this can also translate into more possibilities for employment and livelier business environment. And Mr. Chair, to answer your question kanina, yes, we have already secured the necessary documents needed for the establishment of Iloilo City Hospital. 1, because of the support of the mayor, he has the feasibility study, the certificate of need, certificate of integrity and safety of the said hospital location, and support of the Iloilo Sangguniang Panglungsod, and the commitment of Iloilo City government to establish and to provide staffing requirements and allocate fund for maintenance and operation of the said proposed hospital. Mr. Chair, now my dear fellow public servants, nakita niyo po kung paano the city government and the House of Representatives to this representation, we are one in our pursuit of providing for quality health care to every Ilonggo. With this, Mr. Chair, public servant, I stand before you to ask for your support in realizing the establishment of Iloilo City Hospital. We are presented with the opportunity to enhance the state of our healthcare, which can very well save lives. Let's take it. Madamogin nga salamat once again, Senator Bongo, fellow colleagues, and Senator Mig Subiri, and of course, Mayor Jerry Treñas.
Salamat gid Ma'am Congresswoman Jam Baronda. For the record, Mayor Jerry Treñas is also here with us. Sir, salamat po. Dr. Annabel Tang, salamat po sa inyong lahat. At We shall now discuss LGU hospitals without budget in 2022. First, we will now discuss LGU hospitals House Bill number 10376, upgrading the Orani District Hospital. We call on Congresswoman Geraldine Roman. If Congresswoman is not around, may we now hear Dr. Rosalie Manubay.
Good morning, Mr. Chair, and good morning po everyone. Orani District Hospital is a 45-bed Level 1 government hospital administered and operated under the provincial government of Bulacan. The hospital, as it stands now, is both non-strategic in location and inaccessible. ODH is located several blocks from the main roadways. This creates an issue when transporting emergency cases to our ER, where the general public has to navigate through tight alleys obstructed by parked cars, domestic animals, and pedestrians. The signage leading to the hospital also does not help, as they are already obstructed by other structures missing or unreadable. The hospital is also situated in a densely populated residential area. This poses a health risk to nearby residences and might be a cause of a catastrophic outbreak if ever we encountered a highly communicable case. This project proposes the relocation of the hospital into a safer location, easily visible to commuters and easily accessible to all. This will solve most of the issues concerning the current hospital structures and will totally change the perspective and outlook of the hospital to the people that we serve. So also improving the services and enhancing efficiency and competence, an upgraded facility will be beneficial to decongest the overpopulated Bataan General Hospital. The provincial government of Bataan see the need to establish a level 2 district hospital to aid the Bataan General Hospital and Medical Center in providing specialized level of care among its people. With our request to improve ODH by constructing a new hospital, the Department of Health funded the project through Health Facility Enhancement Program. The PGB identified the new location for this project, providing more spacious area for hospital development and further expansion. Project was granted, hence started in October 2021. This covers the construction of the hospital structural steel frame. The construction targeted to have 100% completion at the end of March of the current year. Subsequently, in January 2022, the funding for the continuation of this project, which is phase 2, was appropriated. This will cover the construction of a 3-story building consisting of areas for various hospital services to include outpatient, ER, dental services, laboratory, radiologic, pharmacy, administrative, and clinical areas, and fire, water reserve, and powerhouse. This building plan has allotted an approximate of 65 beds for patient care. So this is 135 bed short to be licensed as 200 bed level 2 hospital. So in realization of a completely constructed new Orani District Hospital to be renamed Antonino Tony P. Roman Memorial Hospital, provision of various structure as well as availability of various medical and other equipments is necessary. So that's all po. Thank you.
Salamat po. Maraming salamat po, Doktora. Next, we have House Bill number 10362, establishing the Zamboanga Sibugay Medical Center. May we recognize Attorney Ana Lisa Gonzalez, ma'am.
Thank you, Honorable Chair. Good morning, and good morning to the Honorable Congresspersons and guests present. I am here on behalf of Congresswoman Ann K. Hofer, who unfortunately could not join this hearing today. On her behalf, I am respectfully adopting the explanatory note of House Bill number 10362 as her sponsorship speech. We emphasize that this bill, which seeks to establish a medical center in the province of Zamboanga, Sibugay, to be known as the Zamboanga Sibugay Medical Center, will be the first level 2 hospital in the province. It will provide Sibugaynons access to affordable and quality medical care without the need for costly and time-consuming travel to hospitals outside the province. We are thus requesting for the immediate approval of this bill, Your Honor. Thank you, Honorable Chair.
Salamat, Ma'am Attorney Annalisa Gonzalez. Next, we have House Bill number 10254 establishing the Liluan Children's Hospital. We recognize Congressman Duke Frasco, sir. Kumusta man diya Cebu?
Okay rami, boss. Kumusta na, boss? Senator, how are you?
Okay lang po. Sir, you may proceed po, sir.
Daghang salamat, Senator. Senator Bongo, Senator Angara, members of the Senate Committee on Health, my colleagues in the House, to our resource persons, maayong buntag kanatong tanan. First and foremost, I'd like to express my thanks to Senator Bongo for all your help to the people of the province of Cebu, and specifically my district, the 5th District of Cebu. Daghang salamat, boss. And thank you, Senator, for including in the agenda today my bill, House Bill 10254. House Bill 10254 is an act establishing in the municipality of Liloan, province of Cebu, a children's hospital to be known as the Liloan Children's Hospital. Liloan is a first-class municipality in the province of Cebu, almost a city, with a total land area of over 5,200 hectares. As per the 2020 Philippine Census of the population of Liloan is over 153,000. The proposed hospital will cater not only Liloan, but to individuals from the north of Cebu, predominantly the 4th District and the 5th District of Cebu, with a combined population of over 1.6 million people. While the municipal government of Liloan currently runs the Liloan Community Medical Emergency Services Center, or LCMES, which was established during my time as mayor in June 2012, Liloan currently does not have any hospital which caters specifically to pediatric concerns. The DOH position papers, both from the region and the central office, have both supported and recommends the establishment of more health facilities in the province of Cebu. To quote the DOH Office of the Secretary position paper, in the year 2020, the province of Cebu has 11 government hospitals and 5 private hospitals with a total of 5,096 beds catering to a population of over 5.1 million people. The proposed measure will aid in the strengthening of the province's healthcare provider network as intended in the implementation of the Philippine Health Facility Development Plan and as aligned with the Universal Health Care Act. Apart from the local concerns, it is to be re-emphasized that it is our country's commitment under the United Nations Sustainability Development Goals to reduce child mortality, improve mental health, and combat other women's and children's diseases. The establishment of the Liloan Children's Hospital, as herein proposed, is geared towards the attainment of such goal with the municipality and the province of Cebu. Hence, approval of this measure is earnestly requested. Daghang salamat, Mr. Chair, maayong buntag.
Salamat po, Sir Congressman Frasco. Next is House Bill number 10248, increasing the bed capacity of the Unayan Municipal Hospital. May we hear from Dr. Raquelina Benito, Chief of Hospital, ma'am.
A pleasant morning to everyone and to you, your honors, and of course to Chairman Senator Bongo and the members of the Committee on Health. Assalamualaikum warahmatullahi wabarakatuh. May peace be upon all of us. Before I enumerate the reasons why Unayan Municipal Hospital should be upgraded from 10-bed to 50-bed district hospital, allow me to give a very brief historical background. Unayan Municipal Hospital was created based on Republic Act 6937 of 1990. Since the initial operation in 1995 or 27 years ago, it was never been upgraded. The following are the reasons why it should be upgraded to at least 50-bed capacity district hospital. Unayan Municipal Hospital is a 10-bed capacity hospital with only 24 plantilla positions. The bed occupancy rate has gone up to 400%, meaning it caters to 40 or more inpatients per day. Because of the increasing number of inpatients, the hospital management is compelled to implement a 45-bed, which is far beyond its authorized bed capacity as a 10-bed hospital. This scenario causes congestion in the hospital area. More so, hospital personnel are always overworked. Our already meager MOE become more inadequate. The hospital is strategically located in a geographically isolated and difficult area, meaning GIDA. It serves mainly 5 GIDA catchment municipalities with a population of almost 180,000. But because of proximity, hospital services extends to nearby 5 more municipalities, making it as to cater rather 10 municipalities. The DOH standard ratio of bed to population is 1:1,000 population. Unayan district population is more than 180,000. Therefore, a 10-bed hospital cannot suffice the big number of population. Lastly, but not the least, most of our patients are indigents. They cannot afford to pay medicines and other medical supplies, and much more to travel to other hospitals. Unayan Municipal Hospital is the most accessible to them. Therefore, its upgrading is very vital to maximize the accommodation and maintaining the good health status of the indigent populace. Before I end po, I'd like to thank Congressman Yasser Balindong in sponsoring House Bill 10248, and of course to you, Honorable Chairman, Senator Bongo, and the members of your committee. God bless po. Assalamualaikum.
Salamat po, ma'am. Next is House Bill number 10247, increasing the bed capacity of the Balindong District Hospital. If Kong is not present, may we recognize Dr. Mashiding Lumandong, the Chief of Hospital.
Good morning, everybody. I'm representing Balindong District Hospital under Bill number 10247. Balindong Municipal Hospital is 10-bed authorized bed capacity with a catchment area of 6 municipalities.
Your Honor.
Pasensya na po, medyo napuputol si...
Your Honor, I can speak for Dr. Lumandong. I'm the Chief of Staff of Congressman
Go ahead,
Balindong.
Attorney Noel, sir. Go ahead po.
Yeah. We apologize, Your Honor, that Congressman Balindong cannot make it today because also of poor connectivity. And he tasked me to make a representation for him for House Bill number 10247. The 10-bed capacity Balindong District Hospital was established by virtue of Batas Pambansa bilang 420 enacted in 1983. In 1986, it became the core referral hospital of the Balindong district system, composing of 6 municipalities, namely Balindong, Tugaya, Bacolod, Calawi, Madalom, Madamba, and Ganasi. The nearest tertiary health facility is the Amay Pakpak Medical Center, which is about 18 kilometers away. After more than 35 years of its existence and with the increased population of its catchment area, there is a need to increase the bed capacity of the hospital from 10 to 50 to effectively cater the health needs of the population. Mr. Chair, representative of the BARM, since it is the BARM that will be funding the hospital, not the provincial government, is also here, the Director General of BARM, to support both House Bill 10247 and the previous Bill 10248, Your Honor.
Salamat po, Attorney. Next is House Bill number 10246, establishing a satellite district hospital of the Northern Mindanao Medical Center. Then House Bill number 10014 and Senate Bill 1399, increasing the bed capacity of the Eastern Pangasinan District Hospital. There are no resource persons present for these 2 House bills. We will just ask them to submit their position papers. Let me proceed now to House Bill number 9980, establishing the San Jose del Monte Mental Wellness Center. We recognize Congresswoman Ma'am Rida Robes. Congresswoman, please.
Hello. Hi.
Yes, ma'am. Morning po.
Good morning. Good morning, Senator. Good morning, Mr. Chair, distinguished colleagues, guests, and invited resource persons. Allow me to introduce House Bill number 9980, entitled An Act Establishing a Mental Health Clinic in the City of San Jose del Monte, Province of Bulacan, to be known as the San Jose del Monte Mental Wellness Center, and appropriating funds thereof. House Bill number 9980 aims to establish a mental health clinic in the city and provide services such as counseling, therapy, and other psychiatric services. The local government of San Jose del Monte has always been on providing basic services for its people, such as food, shelter, security, and other crucial necessities that would elevate the lives of its constituents. The onslaught of the COVID-19 pandemic has proven that the district was able to mitigate the resurging problems. However, the difficulty arose when mental incapacity such as depression, anxiety, and traumatic experiences began amongst the people. Such psychological problems must be given attention and properly addressed. It has always been taboo in our culture that anything about sickness of the mind is unacceptable and frowned upon. This mental health clinic that this representation desires to establish will be a catalyst for future cure, education, and mental health. It is timely that we recognize and pass this important bill. Yun lang po, Mr. Chair, Senator, magandang umaga po sa ating lahat.
Salamat po, Congresswoman Ma'am Rida Robes. Next will be House Bill number 10583 and Senate Bill 2448, establishing the Teodoro and Pipito Memorial General Hospital. May we hear from Congressman Rogelio Neil Roque, sir?
Magandang umaga po. Mabuhay po kayo, Senator Bongo, Congressman O'Neil Roque. This
Pwede po lang ganun, no?
House Bill 100583 was filed during the 17th Congress and was approved in the House and approved in the Senate as 2053. We just refiled this bill, Senator Bongo, for consideration in this committee. It was already approved in the committee of Senator Ejercito during the 17th Congress, but was not approved or filed in the plenary. So we just refiled it, Senator Bongo, for consideration. Thank you, Senator.
Okay. Salamat po, Congressman Neil Roque. Next is House Bill number 10297, establishing the Aklan Geriatric Medical Center. We recognize Congressman Carlito Marquez. Sir.
Ba't wala siya, ano? Akala? Tingnan.
Babalikan na lang po natin yung House Bill 10297 or you may submit your position paper. Last for this cluster will be the House Bill number 9537, Senate Bills 2419 and 2384, establishing the Isaac Tolentino Memorial Medical Center.
Senator Go?
Yes, go ahead.
Sorry, si Kong Kiko po. I just received a message from Kong Marquez asking if I
Break
could,
muna
on
tayo,
his
ano?
behalf, do the sponsorship for the record of the Senate.
Tawag mo si Billy. Hindi
Go ahead, Sir Kiko.
Billy sumagot.
Yeah, no. So on behalf of Kong Carlito Marquez, no, I would like to sponsor the House Bill number 10297, an act establishing in the municipality of Calibo, province of Aklan, a geriatric medical center, no, to be known as the Aklan Geriatric Medical Center, and appropriating funds therefore. Most of the money will actually come from the provincial government of Aklan, but the bill requests that the Secretary of Health shall include in the department's subsidy program support for the capital outlay requirements of the hospital. We hope that the committee sees it fit to pass the measure on behalf of the senior citizens and the geriatrics of the province of Aklan. Yun lang po. Salamat po, Senator Go.
Yes.
Salamat po, Sir Kiko. May we hear from Congressman Bambol Tolentino? Sir? Sir Bambol.
Good morning, Chairman. First of all, I would like to thank the Senate bills also yung authored by Senator Bato and Senator Tol, and the other Senate bill is Senator Marcos on these two bills and regarding my House bills na creating this hospital, establishing this hospital. Na-realize po namin yan, Mr. Chairman, not only due to pandemic, no, but also after the Taal eruption na kulang talaga ang health facilities. Sa laki po ng probinsya, malayo po yung ng Cavite, malayo po yung regional hospital, nasa Bacoor po, nasa baba. Ang provincial hospital po nasa gitna. So half of Cavite wala pong ganyan kalaki. So with that, sana po makonsider itong House Bill na to, establishing this. And the Senate version is for the sports medical health facility, including the rehabilitation, na napakaganda po talaga dito sa Tagaytay ilagay. Not that I'm a POC president, but wala po ata tayong sports hospital. Maganda po mag-rehabilitate din dito sa Tagaytay dahil po sa climate. And besides, we have already complied all the requirements. Magbibigay po ang city, magdodonate po ng 2.5 hectares for that hospital. Kahit po medyo pricey, Mr. Chairman, ng lupa dito sa Tagaytay, amounting to almost 250 million for that donation. So with that, sana po makonsider itong House Bill na to. Thank you very much po, Mr. Chairman.
Salamat, Congressman Bambol Tolentino. Senator Tol Tolentino, do you have any message or manifestation, sir? let me now proceed. Since these hospitals are LGU hospitals, LGUs will shoulder the funding for their operations, but the national government shall provide subsidy for capital outlay. May we hear the comments of the DOH and DBM on the bills on these LGU hospitals?
Thank you, Mr. Chair.
Let
Thank
me
you, Mr.
repeat.
Chair.
Yes, go ahead, Yusek David. You may proceed and may we hear your comments.
Thank you, Mr. Chair, Your Honors. The Department of Health supports the aforementioned bills on various LGU hospitals, which shall aid in strengthening the hospital healthcare provider network as intended in Philippine Health Facility Development Plan 2020-2040 and as aligned with the Universal Healthcare Act. For hospitals under the management of local government units, funds required for the operation shall be charged against internal revenue allotment LGUs and or from other revenue sources. Thank you, Mr. Chair.
Salamat. ASEC Lasara of DBM, please.
Naka-unmute na po kayo.
Thank you, Your Honor. For the mentioned bills, we likewise interpose no objection on the upgrading of these hospitals, considering that it shall be funded by the local government units consistent with the local government code and the recent Supreme Court decision on the Mandanes case. On the capital outlay requirement, let me emphasize, Your Honor, that the Supreme Court ruling shall significantly reduce the financial capacity of the national government to provide health programs, which includes hospitals and the tertiary health services. Nevertheless, should the DOH subsidy support for capital outlay expenditures, as mentioned in the bills, may be proposed for inclusion programming under the HPEP of the DOH, consistent with its health facility development plan. And again, it will be subject to the usual budget preparation, evaluation, and review by the department, meaning the considering the implementation readiness of the project, their absorptive capacity, and the availability of the fiscal space. That's all, Your Honor. Thank you.
Salamat, ASEC Lasara. Are there any other comments from my fellow senators? If there are none, the bills are hereby approved, subject to the submission of the required LGU resolution supporting the intention of the measures discussed. Please submit a copy of the resolution to the committee before May 2022. Now, let us now proceed.
Mr. Chair, thank you so much.
Thank you, Mr. Chairman.
Thank you, Mr.
Salamat po, Mr. Chair.
Salamat sa inyo lahat.
Thank you, Mr. Chair.
Dagang salamat, Mr. Chair.
Salamat po. Salamat talaga mula sa lungsod. Salamat po.
Senbiji, thank you so much. Kuya, see you here.
Senator Go, thank you very much on behalf of Congressman Villarica po.
Salamat po. Let me now proceed to the bills for renationalization. We have 5 House bill. Let me start first with House Bill number 10452, the Ruben E. Ecleo Senior General Hospital. We recognize Congressman Alan Ecleo, sir. Kumusta na po dyan?
Good morning, sir. Maraming salamat po. Can you hear me, sir? Sorry. Naririnig kaya ako.
Go ahead, sir. Go ahead. You may proceed.
Thank you so much, Honorable Chairperson, members of the Senate Committee on Health, our esteemed resource speakers. Thank you for the invitation and for the opportunity to speak with this very important matter to the province of the Ilagan Islands. I'd like to first thank Senator Bongo the chairperson of this committee, for the help that he facilitated and personally given to our province in the aftermath of Typhoon Odette together with President Rodrigo Duterte. Thank you so much, sir. Maraming salamat talaga. And we also thank the DOH for the assistance they extended to our province so that healthcare can still be delivered to our constituents. But most of all, perhaps, we thank the doctors and healthcare personnel who offer their help in voluntary capacity to cater to patients and families in the Nagat Islands. Last June 3, 2020, we filed House Bill 6949, which intends to convert the facility into a Level 2 hospital. The bill was successfully transmitted to the Senate last November 2021. Even before the pandemic, our fellow Dinangatnons have struggled to access important healthcare services, as all other health facilities in the island are on a mere infirmary level status, lacking specialist facilities such as an adult intensive care unit, pediatric intensive care unit, and a high-risk pregnancy unit. Thus, patients in need of such facilities must be transported by sea to Caraga Regional Hospital in mainland Surigao City, province of Surigao del Norte. COVID-19 has intensely highlighted the insufficiency of our health facility to accommodate our population. And with Typhoon Odette, the province is now in an even worse situation, with many of our healthcare facilities severely damaged, if not totally destroyed. For our part, we have coordinated with DOH and other institutions to improve and provide facilities in the Basilisa Mother and Child Hospital. And even before our bill was passed in the House of Representatives. This is why the hospital's infrastructure is already prepared for its conversion. It only needs this venerable body to pass the bill on the Senate level. Ladies and gentlemen, your votes of support today will not only restore healthcare in our province to normalcy, but also begin making it better than normal. The facility is ready, the people are ready, and I hope, ladies and gentlemen, members of this committee are ready to deliver on this promise of accessible and reliable healthcare for the people of the Nagat Islands. Thank you so much, and good morning, everyone.
Salamat, Congressman Alan Ecleo. Next is House Bill number 10325, the North Cotabato Regional Hospital. We recognize Congressman Tejada. If Congressman is not around, may we hear Dr. Venancio Ang, the Provincial Administrator of North Cotabato. Doc, go ahead po.
Good morning, Honorable Chair and Honorable Committee members. I would like to express on behalf of our Congressman Tinting Tejada his manifestations. Allow me to read it. I initially filed the renationalization of operations and the upgrading of Cotabato Provincial Hospital to a tertiary level regional hospital to be named North Cotabato Regional Hospital during the 17th Congress. However, due to lack of material time, we were unable to pass the bill. For some time now, the Soc-Sargent region has found itself wanting for a regional hospital that they can call their own following the inclusion of Cotabato City, including the Cotabato Regional and Medical Center or CRMC in the Bangsamoro region. A show that is not easy to fill, but CPH Cotabato Provincial Hospital is willing to wear. In preparation for the renationalization of CPH that takes this new rule, we must first capacitate them. On the average, CPH has exceeded 100% occupancy rate. Hence, the proposal to increase the capacity from 143-bed capacity secondary hospital to a 300-bed capacity tertiary hospital. However, despite being among the most expensive services being provided by the province, the provincial government has maintained a position not to generate profit from its health investments and adopted a socialized payment scheme. With the increasing demand for healthcare services, and the subsequent increasing occupancy rate in the hospital, it will get more and more difficult for the provincial government to financially sustain the health facility. In recognition to the people's constitutional right to health, the renationalization of Cotabato Provincial Hospital is the only viable option left. Aside from the bill's express intent to ensure the continuity of healthcare delivery to the people, this bill also holds a symbolic importance. This bill is the government's manifestation to the Soxargent people that the government is taking an active role in ensuring accessible, efficient, equitable, and adequately funded healthcare system in line with the spirit of universal healthcare. Together with the local officials of the province of North Cotabato, we are praying that this time we will be able to beat the clock and pass this bill for the people of Soxargent. Mr. Chair, with the indulgence of the committee, I would like to recognize the people who poured their hearts and labor for the passing of this bill. With us today, serving our resource person are our Provincial Health Officer, Dr. Eva Rabaya, our Cotabato Provincial Hospital Chief, Dr. Joel Nelton Sungkad, and I believe that it is safe to say that the people of Cotabato is one with this presentation and earnestly seeking for the favorable consideration of this bill. And may we respectfully request for the support of the honorable members of the committee to facilitate the passage of this bill. Thank you, Mr. Chair. Once again, good morning.
Salamat po, sir. Next is House Bill number 7970 and Senate Bill 1377, the La Paz General Hospital. May we call on Congressman Joseph Bernoser. Musta po? That's
Mabuti po, Mr. Chair. Maraming salamat po. Senator Bongo, Chairperson of the Senate Committee on Health and Demography, our colleagues in both Senate and House of Representatives, resource persons, guests, wonderful morning to all of you. Let me first express my gratitude to the committee for taking up House Bill 10055, which seeks to convert La Paz District Hospital into the La Paz General Hospital. The current hospital is an infirmary-type health facility with 25 beds, primarily catering to the residents of La Paz, Danglas, and Lagayan in the province of Abra. Our drive to convert it into the 100-bed La Paz General Hospital is due to the increasing demand for adequate facilities that will meet the medical needs of the people. With the proposed 100 beds for the hospital, it will greatly improve the delivery of basic healthcare services in the province. The creation of the La Paz General Hospital will streamline the medical services provided by the government alongside other health facilities in the province to serve more Abreños in need of immediate medical attention, eliminating the need for them to seek such services from hospitals outside our province, especially to Baguio City, which is the nearest regional hospital, because of a new and improved hospital is just within the reach. In addition, the renationalization of the La Paz General Hospital under the direct control and supervision of the Department of Health will give it ample attention to ensure that the hospital will perform according to the standards of the state. It will be given sufficient funding to meet the healthcare needs not only of Abreños, but also of our neighboring provinces who may refer patients to this hospital. The renationalization provision is an essential component so as to ensure that the continuous delivery of services will not be hampered by problems that may arise in the future. In other words, this is a guarantee from the state that it will include provinces like Abra in a version of development that is truly encompassing all Filipinos. It is only now at various aspects of development, infrastructure, education, tourism, and among others, that Abra is gaining momentum. During the Duterte administration, change has truly come to Abra. And we would like to keep that momentum going by imploring the fast-track the passage of House Bill 10055 into law. I hope that our persons present today will agree to the proposal to create the La Paz General Hospital is a necessity and would not only serve medical needs but also drive socio-economic development in the province of Abra. With that, the passage of House Bill 10055 is earnestly sought. Thank you very much and God bless to all. Maraming salamat po.
Salamat, Sir JB. Next is House Bill number 9878, the Oriental Mindoro Provincial Hospital. Ito po yung nabanggit kanina ni Congressman Umali, the co-author of the measure. Ito po yung hospital na meron pong malasakit center din po sa Oriental Mindoro Provincial Hospital. May we recognize, since wala po si Congressman Doy, may we recognize Congressman Alfonso Umali.
Good morning ulit, Sendong. Ito yung bill namin. Co-author kami ni kinonsolidate ito. Co-author kami pareho ni Kong Doy. So, ganun din ito, and we want to convert it to a regional hospital. Right now, it's the Oriental Mindoro Provincial Hospital na gusto namin i-convert sa regional hospital. I hope na yan mapasa rin sa chair, together with Kong Doy.
Salamat, Sir Umali. Ako naman po, the more na may pasa natin ng mga hospital, dahil naintindihan ko po yung sitwasyon. Pero siyempre po ay dependent rin po tayo sa DBM, sa DOH, sa mga kasamahan natin sa Senado. Masuportahan rin po nila ito. Next is House Bill number 9837, the Bislig District Hospital. We recognize Congressman Johnny Pimentel. Sir Johnny, magandang umaga po, sir.
Mr. Chairman, mayong buntag. Bislig District Hospital is the main public hospital in Bislig City. It accommodates the healthcare needs of the 2nd District of Surigao del Sur. In the event of emergencies in the area in its contiguous communities, patients are immediately treated there. However, the medical and healthcare needs of the 2nd District of Surigao del Sur has steadily grown over the years. This is bolstered by the current pandemic. The hospital's capacity was last increased in 1992 through Republic Act number 7249, and that was 30 years ago. Presently, the Bislig District Hospital can no longer cope with the increasing demand for hospital rooms, modern medical facilities, and additional healthcare services. Hence, there is an evident need for the district hospital to upgrade the facilities and hospital bed capacity. This bill seeks to convert the Bislig District Hospital in Bislig City, Surigao del Sur, into a medical center known as the Bislig City Medical Center, increasing its bed capacity to 200 beds from 50 beds. For the aforementioned reasons, the undersigned submits this bill for the consideration of this august body. Mr. Chairman.
Salamat po, Sir Johnny Pimentel, sir. May we hear the comments of the DOH and DBM on the bills on renationalizing some LGU hospitals? May we hear Yusek Lilibet David of DOH, ma'am?
Thank you, Mr. Chair, Your Honors. The Department of Health supports the establishment and/or upgrading of hospitals, the aforementioned bills. And the Department of Health also supports provisions of Executive Order number 138, Series 2021, otherwise known as full devolution of certain functions of the executive branch to local governments, and creating committee on devolution and other purposes. And the department deems it appropriate that the aforementioned bills be under the supervision and administration control of their respective provinces, and local government units. Thank you, Mr. Chair.
Salamat po, Ma'am Lilibet. May we hear ASEC Cristina Clasara of DBM, ma'am.
Thank you, Your Honor. For the department, the DBM does not support the renationalization of mentioned hospitals already being managed and operated by LGUs. As earlier mentioned, the Supreme Court Mandanas ruling will result to a corresponding decrease in the already tight fiscal resources of the national government. And on the other hand, it will increase the shares of the LGUs in the national taxes, which should prioritize the effective delivery of the devolved services under the local government code. Nevertheless, similar to our earlier comments on the various bills taken up this morning, we suggest that the funding requirements to cover the infrastructure and equipment upgrades be proposed and included in the programming under the HPEF of the Department of Health, consistent with its health facility development plan. Again, this will be subject to the usual budget preparation, evaluation, and review, taking into consideration the implementation readiness, the absorptive capacity, and of course, the availability of the fiscal space. With that, thank you, Your Honor.
Salamat po, ma'am. We take note of the comments. Mahalaga po na may funding source ang mga hospital nito para hindi tayo mahirapan ipaglaban ito sa plenaryo. Yun po ang naging issue before. At we defer to the DBM and LGUs to submit the possible funding source for these hospitals considering the Mandanas ruling. Kung ako lang pong masusunod, talagang suportado po basta upgrade ng ating mga hospital. Isa po ito sa pinaglaban ko noon sa plenaryo, pero ang problema talaga ay ang pondo. Baka masayang lang po ang mga batas na ito kung wala naman pong pondo. With that said, the LGUs should work with the DBM to sort out the funding for these hospitals to be renationalized before the passage of the bills. Do my fellow senators have any other concerns regarding this issue? Kung wala na po, maraming salamat po sa lahat ng participate, sa mga kasama natin sa Kongreso. Ma'am, sir, salamat po sa mga resource persons, sa mga doctors, salamat po sa inyo lahat. And of course, sa mga frontliners, salamat po sa inyong sakripisyo sa panahon ngayon. Hindi po tayo magiging successful sa ating kampanya dito sa laban sa COVID-19 without your help. Asahan niyo po na ipaglalaban ko po inyong kapakanan always as a committee chair. So magtulungan lang po tayo na unti-unti na tayo makabalik sa ating normal na pamumuhay. Magtulungan lang tayo. Sino ba namang magtutulungan kung hindi tayo lang po mga kapwa nating Pilipino. At kailangan rin po kooperasyon ng bawat isa. So, kung wala na po, maraming salamat sa inyong oras. If there are none, this hearing is hereby adjourned. Salamat po.
Maraming salamat po, Senator. Maraming salamat po.
Thank you.
Thank you very much, Senator Go.
Salamat.
Thank you so much, sir.